After all, how to run high-functioning systems, you all do this every day. The stories that we've had at this conference, what Bill will talk about, what our awardee tonight will talk about, I mean, you've all done it, right? How hard can it be for me to replicate it, for me to figure out what are the best practices? And I think at least the answer is, in 11 months, not that hard. The challenge is not intellectual in my case. I haven't, to the best of my knowledge, invented anything or thought of anything new, and I'm not even sure I would fit the theme of innovation. But I do feel that my work has fit the theme of multipliers. Not so much about intellectual, although I fully subscribe to the theory and I think it's absolutely right. But also, when I go to Los Angeles, what I look at is, you know, okay, well, who can help me with this? And I'm saying that I want to provide more care of a higher quality at a lower cost. Right? Who's going to argue against it? No, no, I want to provide lower quality care at a higher cost to fewer people. No one, right? So here's the goal. And so what I view is, okay, well, you know, how do you help me? How do you help us? And so to everyone that I've met in Los Angeles, whether they've been a government person, whether they've been someone in philanthropy, whether they've been in the university, my goal always is okay, great to meet you. Let me tell you about the challenge. Could you help me? How could you help me? What could the university do for us? What could philanthropy do for us? What could the Office of Personnel at the CEO do for us? What could the aides do for us? And because of that, for example, the Los Angeles' lower income health program, for the first 18 months before we launched this new campaign, they had enrolled about 55,000 people. In the last 5 months, so a much shorter period of time, we've been able to enroll 35,000 people in just a few months. But also marshaling the advocates. That's been another great area. You know, I met with a variety of advocates, housing advocates, people trying to help people out of poverty, health advocates, you know, and my issue to them is help me. You know, we're all on the same side. I don't need you to tell me what I'm doing wrong. I need you to help me to achieve what we all believe is right. Many of the lessons about leadership that are the subject of today are even more important when you're in public safety net systems. Often we, as you know, we don't hire and fire very easily. It's very difficult for me to hire anyone. It's very difficult for me to fire anyone. So all of what I have to focus on is mission, right? Getting up every day and convincing people what an amazing mission it is to take care and provide quality health care to people who really need it. Isn't that a reason you would want to do your absolute best?
Many of us who have been in this field a long time, we go through different segments and different phases. And each time, each phase offers a new opportunity for leadership, and it provides an opportunity to really develop new skill sets. And I think that's part of the great thing about healthcare is I interact with our fellows and have a chance to lecture at some of the health administration programs. I usually like to talk about that for those of us in this field, this is perhaps one of the most exciting times because there are few fields out there that are really going through a tremendous transformation of what we're doing today. That's the exciting opportunity right now in healthcare, and to be a healthcare leader. It is the opportunity to kind of reinvent and think differently and do different things. You know, in the past, leadership success was sort of what you did within your own organization or building your own health system. And there's been great success out there. What I see, though, is sort of this leadership transformation that we're getting into. It's less about what we do within our organization and more what we do outside our organization in collaboration with our competitors. What healthcare is about It's about collaboration. It's not about competition. And Porter and others have written a lot about what's good competition and what is bad competition. And in many ways, it kind of reflects the immaturity of the field, because many of us are engaged in bad competition with the idea there's a winner or a loser. Part of today's theme is to talk about population management. And when you're dealing with population management, and we're trying to assume responsibility for improving the health status of our communities, that isn't built around competition. That's built around trying to pull together as many groups that you can in the development and a focus on how are we truly going to improve the health status of our community, which frankly brings to bear a whole set of different leadership challenges. And it isn't just being about a diminisher or a multiplier. It is about, as leaders, how do we change our orientation from being very focused on competition to now becoming very focused on collaboration and working through the multiple agendas, working through whether it's with the health department, the Medicaid program in the state, and all of us who are involved in running health systems and our federally qualified health centers. How do we work off of a single agenda? Envision was to try to develop leadership skills that can transcend to the community to improve the population that we are accountable for.
I spent a lot of time talking about individual patients, and I think that would also broaden to individual people in the community. And then it goes for a few of the different themes, I feel. First, I think we underestimate the power of healthcare professionals as healers. And I say this as someone who just finished attending for 2 weeks on the medicine ward at USC, a university hospital, LAC USC. And the extent to which everyone, the doctors, the nurses, the respiratory therapists, the pharmacists, are all technocrats. Everybody's sitting behind a computer, everybody's collecting information. Some people are trying really hard using that information, some people are not trying so hard. But the idea that you would go into a room and use yourself as a healing agent to make someone feel better, pretty much lost. And I think that's very unwise. I don't think you need to be a doctor to be a healer. I think a variety. I've had patients whose strongest commitment at the clinic was to the receptionist at the front desk, and that was the person they came to see. There are a variety of ways to, touch people's lives. So what I've been very focused on as a way to change. So I feel, okay, so I have a large system, not really focused on quality of care. How am I going to get them? I could talk about quality of care and metrics for quality care and the things we're measuring and number of UTIs and number of falls, which people tend to blur over a little bit. Or I could take some very direct steps of, adding the patient specifically to our mission statement. I now require all of our administrative physicians to see patients as part of their job. Those who hadn't done it for a while, I asked to go back and do whatever refresher courses they needed. Because to me, it's very important to say to the organization, there's a specific reason that we're here, and it's not about us.
If you define yourself as a change agent, which is something I've always have done, and that is an activist role in a positive sense, it is about, again, connecting the vision with why you need to change. And it's the old adage is that we love innovation. We just don't necessarily love change, especially if it happens to me individually. And so part of your role as a salesperson, part of your role is really bringing people along. And when I think about a multiplier, the multiplying effect is that to really achieve one's vision, one does have to multiply and have other advocates as a part of it. Everyone brings their own agenda to the table. And in many ways, it's a protective agenda. And the difficulty we have is kind of moving from individual agendas to a community agenda. And that's a more difficult transition than, frankly, I had anticipated, and working through it. And it's complicated because some of the funding streams work differently. The federally qualified clinics work differently and have a different funding stream than some of the traditional groups have. And so it is trying to kind of move away from this, and we're spending a lot of time with regard to, let's make sure we know what we're focusing in on, and starting in smaller bites, because these things are complicated